All right, so now we're ready to begin the mandible. So for the sake of being able to show you plate placement and whatnot, I do have the model in lateral recumbency so you can see how I'm doing that. And then I'll place the model into dorsal recumbency so you can see how it's shot. So we're going to be starting with tooth number 10 and 11. So these are the two molars way in the back of the mouth. And this can be a challenge shot for many dog sizes because it's so difficult to get this giant plate into a tiny little mouth. So we do the best we can. Sometimes we don't make it quite as far as we'd like, but with good oral exam techniques, you should be okay to get as far as you can and stop there, because we don't want to go too far and potentially hurt the patient. So I'm going to take the plate and I'm going to put it behind these two teeth. So for tooth number 9, 10, and 11, I am able to physically put this plate behind those teeth in a dog. I don't recommend that we do this in cats because the newer plates that are coming out now are much thicker, and it's a little more challenging to get it back behind those teeth without causing a lot of trauma to the tongue and soft tissues in that area. Now, if you're using phosphor plates, that's another story. You can place the plate directly behind those teeth in a cat with a phosphor plate. But we have a regular digital sensor. So I'm going to place the plate, and I'm going to do this in portrait mode. I find this is easier because a lot of times when we do landscape mode, we push it down too far, and we can actually go below the teeth and miss them entirely. So this is a way to get the whole tooth on the plate. So what I'll do is I'll take the corner, this corner here, and slide it behind those teeth, and I will feel underneath here to feel where the plate is. Now, in a live patient, this is a little easier because the tongue's a little more flexible than it is in the model. So I'm going to place it so it's sitting right behind these two teeth. So with that done, and what happens is we have plate above the crowns and we have plate below the crowns. So we are guaranteed to be able to hit these entire teeth back here. So now what I'm going to do is I'm going to put the patient back onto its back for the shooting part of the video. So I'm going to put him on his back like so. And so you're going to aim at the plate when you're doing parallel technique. And what will happen is when you're placing the plate up against the patient, this part of the cone, so the top part of the cone, should go no higher than the bottom edge of the jaw. Okay, so think about where your teeth are and cover that plate with your cone, or aim at the plate with your cone, and make sure that this cone is not higher than the bottom edge of your mandible.